Child Trends webinar. We'd like to wait a few minutes to give other people a chance to join us. So you will experience silence for about another minute or so, and we will be back in just a short while. Good afternoon. My name is Alicia Torres. I'm the Director of Communications and of Hispanic Outreach for Child Trends. Welcome to Child Trends webinar on our recently released evaluation of the Abriendo Puertas Opening Doors Parenting Education Program. These findings, as you may know, were released on June 11th to the public as part of our launch of the new Child Trends Hispanic Institute, which you will hear more about shortly. As you may know, Child Trends is a nonprofit research organization and think tank based in the Washington, D.C. area. For 35 years, policymakers, funders, educators, service providers, and others have relied on our data and our analyses to improve policies and programs serving children and youth. Throughout the webinar, if you have any technical questions, please submit them online. You will see a box on the right-hand side of your screen where you can easily submit questions to our team, and they will get back to you. This is the same place where you can submit questions to our panelists at any time during the presentation. We're going to queue those questions up and present it to the panelists after the presentations have been completed. And we estimate that we're going to have about 15 minutes of Q&A at the end of the hour. So today, I first want to introduce the our panelists. You will first be hearing from Lina Guzman, who is the director of our new Child Trends Hispanic Institute. Lina is a senior research scientist and the co-director of one of our research units here at Child Trends. She holds a doctorate in sociology from the University of Wisconsin-Madison. She will provide you a brief overview of Child Trends' new strategic initiative in our Child Trends Hispanic Institute. As mentioned before, the Institute launched with the rollout of the findings of this evaluation of the Abriendo Puertas Opening Doors program. Then you will hear from Sandra Gutierrez, the founder and national director of the Abriendo Puertas Opening Doors program. As you may know, Sandra has recently been recognized by the White House with the Cesar Chavez Agents of Change Award for her work in early childhood development and Latino children. You then will hear from Ruth Yoon. She is the administrator in the Los Angeles Unified School District in the Parent Community Student Services branch. This study, as you may know, was based in Los Angeles, where we worked with the parents of Latino children soon to enter elementary schools in the LAUSD, the second largest school district in the country. Ruth played a central role coordinating and facilitating this evaluation study. Then finally, you will hear from our researchers who are responsible for this study. They will present the findings. Chris Moore, our senior scholar and principal researcher, and Selma Kaal, our research scientist here at Child Trends. I will now turn it over to Lina Guzman, the director of the new Child Trends Hispanic Institute.
Good afternoon, and thank you, Alicia. I'm delighted to be here today to say a few words about our Child Trends Hispanic Institute, which, as Alicia mentioned, launched exactly 2 weeks ago today. As you know, Hispanics are the largest and one of the fastest growing racial ethnic groups in the U.S. In fact, today, 1 in 4 children in the U.S. are Hispanic, and by 2050, this figure will be 1 in 3. Given the size and growth of Latinos, how Latino children fare will have profound implications for our country. Yet, for many groups of children in the U.S., there's already a significant research to inform the nation's thinking and to guide our investments. This is less true, however, for Latino children and youth, and this gap hinders our ability to invest wisely. Child Trends recognizes the importance of the Latino population and this critical knowledge gap, and we hope that the Institute will help to address this gap. You may ask yourself, what is Child Trends Hispanic Institute and what sets us apart? First, we are a national research center focused on Hispanic children and youth. Our research focuses on the whole child across the life course. We follow Latino children's well-being from birth to adulthood across a range of domains such as early childhood, school, economic well-being, health, and media, to name a few. And we also maintain an eye on the positive. We believe that it's not only important to address the challenges, but also to focus on the many strengths of our community, and to make sure that we integrate those very strengths into the programs and policies that are intended to help support Latino families and children. And the Institute builds very much so on Child Trends' over 35-year reputation, as well as our growing portfolio work that focuses on Hispanics. And to underscore the importance of the Institute to Child Trends, I should note that this is the first time that Child Trends is making a strategic investment of this sort. We don't have an endowment, but we recognize the need and the importance of addressing these critical gaps and are putting our own dollars to help launch and seed the Institute. We're thrilled to have launched the Institute with a focus on our youngest children, the release of the Abriendo Puertas evaluation, a program that recognizes the importance of parents as the first and lifelong teachers of children and offers the Latino community the benefits of research-based programs.
Wonderful. Thank you, Lina. I now want to turn it over to Sandra Gutierrez.
Thank you, and thanks to everyone on the call that's interested in finding out more about Abriendo Puertas and about the Child Trends Hispanic Institute. We are truly honored to be one of the first initiatives of the Hispanic Institute. As we all know, the Latino community is not a monolithic community, and we look forward to the many great and significant future collaborations and contributions of the Hispanic Institute. I'm sure the Institute will go beyond the mere numbers and the assumptions about such a key and important population and look more closely at the great, the many, many funds of knowledge that exist in these communities, and hopefully these findings will be broadly disseminated so that they inspire understanding and solutions and investment in this important community. It makes great sense that the first initiative be about family engagement and parent leadership, and we're very pleased to be able, as a learning organization, Abriendo Puertas is very pleased to share with you the findings and, along with the findings, the many lessons from this evaluation. Before we go forward, I'd just like to give you a very, very brief background on the Abriendo Puertas Opening Doors program. We use a two-generation strength-based approach that builds on parents' capacity and confidence as leaders of their family, and we work with parents with kids 0 to 5. I briefly stated that Latino Hispanic community is not a monolithic community, but I think one thing will contradict that, and I think it's true of parents throughout the world. All parents want a better future and better opportunities for their kids, and this program was created to create that, to make sure, to support and honor parents with that aspiration, to give them tools and information so that those goals, those hopes and dreams, those prayers that they have for a better future are converted into specific goals with informed plans, and that they're equipped to do things each and every day in their home that promote their child's most optimum development. So that's why the program was created. It is based on research and best practices on a variety of topics, some of which we'll cover today. And the heart and soul of the program is to honor parents as leaders and as agents of change, and to honor their life experiences as well, and to couple that with getting research off the shelves and presenting it in a way that's accessible and actionable and that touches on the hearts and minds of parents so they can use it each and every day to promote their child and their family's success. A key part of the program is creating access so that folks have easy access to this information. One of the things that we do to promote that is work through a training of trainers model that creates access over, that values access over ownership of the program. So we work in partnership with a great many organizations, and I thank those of them that are on the call today. Another key component, and I'll end with that, is that you know, things are getting complex. It's very difficult to be a parent, although it's one of the most beautiful experiences in life. It's one of the most challenging responsibilities as well. And things are moving fast, and we work very carefully to keep current and connect parents to resources that could make a big difference to their family's success, such as, just to name a few, the Earned Income Tax Credit, the libraries, access to preschool services, and where available, access to ACA, affordable care services as well. This random control trial conducted, we had the good fortune of having it conducted by Caltrans and to have partnered with one of our partners that we worked with for the last 5 years. It represents a very huge and important milestone for the development and the evolution of Abriendo Puertas, opening doors. It's been a truly edifying experience, and none of this program works without our partners. Our partners bring it to life, and this random control trial and evaluation was conducted with the leadership of Ruth Yoon, who is an administrator at the Parent Community Services branch of the Los Angeles Unified School District. So I'd like to introduce her now and at the same time thank her for her great work in this evaluation and for a partnership that will continue beyond its initial 5 years. Thank you.
Thank you very much, Sandra. This is Ruth Yoon. On behalf of the Los Angeles Unified School District, I would like to thank Caltrans and the Abriendo Puertas Opening Doors program for including our district in this very important study. We're very pleased that the program in only 10 sessions has been able to achieve significant outcomes for parents. We're very interested in scaling up Abriendo Puertas district-wide because our district has over 57% of students that come from homes where Spanish is spoken. Another piece of data is that about 38% of our elementary students are identified as English learners, and Spanish is our number one language in our district, even though we have many other languages that we serve. Dr. Moore and Dr. Kahl are going to discuss the finding during this presentation, and we're very pleased to be involved in the study and also in the ongoing implementation of the program. The slide that I'm going to be talking about actually shows some of the reasons why LUSD became involved with Abriendo Puertas over 5 years ago. Effective parenting for children 0 through 5 years of age is essential to their future educational success and to a healthy society. It's important to note that 1/4 of all children in the U.S. are Latinos, and by 2050, it's expected that this will increase to 36%. Disparities in educational levels among Latino children threaten their chances for success in school and in life. Research indicates that educational success begins at home, way before children enter school formally, and what parents and other caregiving adults do at home is key to their well-being and their learning. These compelling reasons motivated us as LUSD to adopt the program, and we feel that this is really a strategy that works with parents and caregivers 0 through 5 years of age very, very effectively. Over 100 schools have implemented the program successfully, and we plan a large scale-up of the program in this new school year, which begins in August. I'd like just to take an opportunity to thank the LAUSD staff, without whom none of this would be possible. They're a hardworking, committed group, and I'm very proud to work with all of you. And now Dr. Chris Moore and Dr. Selma Kahl will present the evaluation.
Thank you very much, both of you and your colleagues, for collaborating on this study. The Abriendo Puertas evaluation represents an important study because it fills a gap in the study of parenting programs for Latinos. That is to say, there aren't many There aren't many other rigorous evaluations of a parenting program with an exclusively Latino population, and none with parents of children who are soon to enter elementary school. It was conducted, as noted, in the LAUSD, the second largest school district in the nation. It is a rigorous experimental study. It examined multiple outcomes that reflect program goals. For example, reading, activities, diet, and advocacy for the children. We also conducted a companion implementation study with parent focus groups and staff interviews. And the study achieved a large sample size and a high response rate, so we can say that it meets the standards for a high-quality study. First, we're going to present an overview of key evaluation findings. Then we will provide a more detailed description of the evaluation and a summary and a discussion of the findings. Well, we found significant positive parenting outcomes for practices that promote school readiness, for example, reading to the children and library use. For family organizational strategies, such as making plans together as a family. For parents seeing themselves as role models, and for understanding the features of quality childcare. Also, a follow-up analyses with parents in the program group indicate that impacts were sustained over several months.
Thank you, Chris. Also, the study shed light on, other strategies that may be more effective if modified, including giving information to parents about ways they can offer their family a healthier lifestyle, how to foster children's emotional development, and how to advocate for their children in the community. The evaluation study found that parents who attended the program did not seem to adjust their nutritional health and physical activity habits. Parents did not seem to change their practices to encourage emotional development, and did not seem to gain more confidence in advocating for their children except within school. The implementation evaluation provides insight into the pattern of these results. As part of the implementation evaluation, we conducted focus groups with parents and interviews with facilitators. The focus group suggests that parents may have adopted practices that promote school readiness because these practices align well with parents' high educational aspirations for their children. The program may also align well with Latino parents' cultural value of familismo, a cultural value that stresses the importance of nuclear and extended family ties. Under this cultural value, family members consider the needs of the family as important over their own, and they provide support to one another. Parents in the focus group also reported having basic knowledge about healthy lifestyle behaviors as a result of the program. But it was hard for them to actually apply the information because their eating habits are hard to break or due to the high costs of eating healthy. Parents might not have been receptive to the information about children's emotional expressions because the information might not align well with their cultural norms of gender-appropriate emotional expressions. Nonetheless, the Abriendo Puertas program model demonstrates that with modest resources, a brief program can achieve results that help parents gain practices that foster children's skills needed for later school completion and success. As the Latino population grows, knowing what works best for this population offers possibilities to expand the reach of evidence-based effective strategies beyond the 34 states that are doing the Abriendo Puertas program to improve the outcomes of future generations in society.
Thank you, Selma. Now we will provide a more detailed summary of the study results. There were two main research questions. First, does Abriendo Puertas, or opening doors, change the knowledge, attitudes, and behaviors of Latino parents with preschool children? And second, do the impacts last up to 3 months after the program ends for parents in the program in the fall of 2012? The impact study design is shown here. 922 parents enrolled at 23 LAUSD schools were recruited and randomly assigned to be in the treatment group, that is the group that could take Abriendo Puertas then, or to the control group, who had to wait to take the program later. 468 parents were assigned to the treatment group in the fall of 2012, and 454 parents were assigned to the control group. That is, they were put on the wait list. 795 parents, 86.2%, completed the first follow-up 5 to 6 weeks after the end of class, which is a really high response rate, much higher than many other studies. Then 333 treatment group parents completed a second follow-up, while control group parents were offered Abriendo Puertas opening doors that spring. So who participated in the study? Nearly 8 in 10, as shown in the upper left, only spoke Spanish. 1 in 10 were bilingual, while only a sliver were primarily English-speaking. Shown on the bottom, nearly 9 in 10 were foreign-born, generally from Mexico. This is also a very low-income population. Nearly 8 in 20 had family incomes below $20,000.
We conducted 2 rounds of data collection for the implementation evaluations, and the first round consisted of a series of focus groups and interviews with facilitators. And program observations while the program was being implemented were also conducted. The objective of this round of data collection was to learn about parents and facilitators' experiences with the program and to examine program implementation. We went back to the Los Angeles Unified Schools District, LAUSD, a year later when we had findings to the impact evaluation to conduct a second round of parent focus groups and interviews with facilitators. Now, the purpose for that second round was to ask parents and facilitators' opinions about the study results, to help us understand the findings from the impact study, and to learn how to preserve important modules and information in the program. We also wanted to obtain guidance on possible modifications that could improve the program. So what did we find? Before we delve into the findings, let me tell you a little bit about how program participants viewed Abriendo Puertas. Participants in the treatment group were asked 12 program satisfaction questions at the time of their second follow-up. Findings of those questions indicated that parents in the treatment group were positive about the program. For example, almost 8 out of 10 parents reported that they were interested in the program sessions all of the time, and 9 out of 10 reported that the material presented to them was clear. Parents and facilitators who participated in the focus groups or interviews also shared their perceptions about the program. The vast majority of the focus group parents thought the program is culturally relevant and sensitive. Parents appreciated that the program was developed in Spanish and that it was not translated from English, as it is often the case with other programs. The vast majority of parents thought they could relate to the program because it incorporates elements of the Latino culture. For example, it includes children's music from Latin America, music that parents may have heard when they were children, and it also includes culturally familiar games and dichos. Dichos are popular sayings in the Latino culture that convey messages with strong values or beliefs. The vast majority of parents and facilitators also thought that the program teaches concepts in an accessible manner because the program teaches topics with familiar terms, and also the program includes interactive activities that successfully engage parents. The majority of facilitators thought that the program provides a safe place to engage parents to interact and reflect on their parenting skills, and also to build social connections with one another.
I want to do a quick methodological aside first about effect sizes as a measure of the magnitude of impact. Detailed data for all measures, scales, and indices findings are provided in the full report, which is on ChildTrend's website. Here, we are presenting data on effect size, which is a measure of the magnitude of the program impact. It's a widely used measure that is comparable across scales. And for the researchers in the audience, we're reporting on Cohen's D, and we used a 0.05 level of statistical significance, one-tailed. As you will see, most of the effect sizes are in the range of 0.2 to 0.3. This is a modest or small but meaningful magnitude for a 10-week parent education program to produce changes in behavior related to children's educational success. For example, we found that treatment group parents that is the parents who were randomly assigned to be able to take the Abriendo Puertas program, were more likely to practice engaging reading approaches compared with those parents in the control group. For example, they were more likely to stop from time to time and talk about the story with their child, more likely to read a book again if the child wanted to, and to read in a voice that has lots of expression and enthusiasm, and that the child choose what he or she wants to read. There were also positive impacts for parent educational activities. Treatment group parents were more likely to engage in educational activities at home than the control group parents, including playing counting games, reviewing letters of the alphabet, and reading to the child. We asked parents in each survey how frequently they read to their child. Specifically, in the past week, how many days did you read to your child? And you'll see, as you would want, at baseline, the treatment and the control group have basically the same number of days, 3.6. At the time of the first follow-up, control group parents are reading more to their children as well. Their children are getting older, in school many of them. But there's a difference with the treatment group, excuse me, reading 4.94 days a week, almost 5 days a week. And interestingly and importantly, we find that parents stayed at that level at the time of the second follow-up. They are reading to their children 5 or more days a week. We also found that treatment group parents were more likely to use the library compared to parents in the control group. They not only took their child to the library, but they checked out children's materials to take home, such as books, videos, CDs, audio tapes. And treatment group parents were more likely to improve their organizational strategies and their ability to plan and set goals for their children. For example, they were more likely to have talked with their child about the family's plans and activities. They're more likely to take the time to think about how to react to their child's behavior before they did something. They were more likely to develop plans to reach family goals for their children. And treatment group parents were more likely to endorse important characteristics of high-quality early care and education, including healthy snacks for the children, daily reading to the children, active play, and teaching children to play well with others. Also, treatment group parents were more likely to gain an appreciation for their role as models for their children. So they were more likely to agree that what they do matters more than what they say to their child, and how they deal with problems sets an example for their child.
Thank you, Chris. As Chris noted, the impact study found that parents who took the program made important behavioral changes to foster their children's learning, and evidence suggested that these changes were sustained over time. The focus groups with parents provide cultural and programmatic context to the impact findings, and they suggest that the practices parents learned that foster education align well with parents' aspirations in cultural values. Hispanic parents in the focus groups, as other research studies have noted and that we have reviewed, report high educational aspirations for their children. They are willing to do whatever it takes to provide a better future for their children. So it seems that the Abriendo Puertas program builds on the aspirations parents have for their children by providing the tools they need to align their behaviors with their educational values for their children. It may be that also the program aligns well with the cultural values of the Latino parents, such as familismo, as I said a little while ago. It may be that parents were receptive to this information because they want to educationally support their young children, and the program guides them how to do so. To further support the idea that Abriendo Puertas program builds on the aspirations parents have for their children, we found that parents who were randomly assigned in the program felt significantly more confident to advocate on behalf of their children within the school, but not other social settings. As you see here in this slide, parents randomly assigned to the program felt somewhat more confident to discuss a problem with the child's teacher or a child care provider, compared to the parents who were not randomly assigned to the program. Also notice that before the start of the program, participating parents felt less confident in discussing a problem with a teacher or the child care provider, and by the end of the program, they felt more confident compared to the parents who didn't participate in the program. Their confidence level also appears to increase over time. Similarly, as you see in this slide, parents who participated in the program felt more confident in advocating for their child's right in school, and also appears to increase over time. Now, several studies have documented that some Hispanic cultures do not consider that it's necessarily okay or the role of parents to question the experts, such as medical doctors or school authorities. However, as you see here, parents in the Abriendo Puertas Opening Doors program seem to increase their confidence in advocating for their children at school. It seems that parents' educational aspirations motivate them to absorb the information and strategies to feel confident in advocating for their children at school. So again, it seems that the Abriendo Puertas program builds on the aspirations parents have for their children by providing the tools they need to align their behaviors with their educational values for their children. Now, the impact study also found outcomes with less impact, and these suggest ways to improve the program as well. The program also gives parents information about early child development, such as parents knowing that a child's education starts at birth. It gives parents information on how to offer children an active lifestyle and healthier lifestyle, and how to foster children's emotional development. The evaluation study found that parents who attended the program did not seem to gain more knowledge or to change their practices compared to the group of parents who did not take the program. Now, again, the parent focus groups we conducted in round 2 of the implementation provided context for the impacts evaluations, the non-significant ones as well. The vast majority of focus group parents mentioned that diet and healthy living changes are difficult to adopt, even when you know you should. They are difficult to adopt because these are ingrained unhealthy eating habits, and because eating healthy takes time, and they may not always have the time to prepare healthy foods. Eating healthy is also expensive, and they might not have the economic possibilities to do so. The conversations with the participants also suggested that parents might not have been receptive to the information about children's emotional expressions because that information did not align well with their cultural norms of gender-appropriate emotional expressions. So, for example, several parents mentioned that they have been taught that girls express emotions more freely, but that boys should not do that.
Well, to summarize, parents clearly made important changes in behavior to foster their children's learning. Impacts were especially found for practices supporting educational readiness at home, and these impacts appear to be sustained over several months. The study sheds light on other strategies that may be more effective if modified. For example, strategies that address more challenging behavioral changes, as Selma noted, such as changing diet and adopting a more healthy lifestyle, are more difficult to change. And also, parents may benefit from greater exposure to these messages. The findings have implications for programs and for researchers. For programs, it's valuable to frame desired behavior changes in such a way, at least when possible, that they align with the beliefs and worldviews of the target population. For researchers and programs, there are several ways that evaluation contributes to learning. Evaluation contributes to understanding what works, and I think this is readily understood and becoming even more widely understood all the time. But the fact that evaluation can and should inform what can be improved is less commonly understood, but it is an extremely important role for evaluation. Well, in terms of next steps, many things are planned. We plan to complete a journal article and submit it for peer review. We also plan to submit our report to What Works clearinghouses. We know that the Abriendo Puertas Opening Doors staff are already working actively to enhance the curriculum to make it even better. And it would be useful to examine Abriendo Puertas Opening Doors in other cities beyond Los Angeles. That's a future possible next step. There are not currently plans to do that, but we think that would be a wonderful next step. It would also be valuable to assess child outcomes. In the long run, the goal is to enhance children's school readiness, their academic success, and their general well-being. So it would be valuable to do a rigorous study that examines parenting practices and child well-being. So in sum, this study found that with relatively few resources, an evidence-informed and well-managed parent education effort can improve parenting behaviors that benefit preschool children as they start their academic journey. Thank you.
Wonderful. Thank you all. This is Alicia Torres again, and I've been monitoring the questions as they come in. And I think that, Chris, you may have addressed a couple of the ones that came in, but I want to be sure to pose them again. One of the ones that came in is, since the study you conducted was in the Los Angeles area, what did the findings mean for other areas where the Abriendo Puertas program is currently being implemented?
Sure. Well, it's very important to have a rigorous random assignment study that finds impacts even in one community. Los Angeles is a unique and important and very large place, but it would also be valuable to examine other populations as well as other communities to confirm the findings. It's always useful to have a second study, but the big difference is having the first study.
Great. And along those same lines, there was a question that came in regarding whether the children in the treatment and control group will be followed into grade school to see if there is any significant improvement in academic outcomes.
Well, in this particular study, both the treatment group and then eventually the control group have been offered the Abriendo Puertas program. And so this particular study, we would not be able to follow the children, and we don't have plans to do so. But I do think that would be a really valuable next step.
Great. Let's see here. We have, we've got a lot of questions coming in. Okay. There's a couple that have come in for Sandra and for Ruth. Sandra, there's a few questions here regarding whether all the Abriendo Puertas programs are administered through local school districts.
Question, no. There's a variety of settings where Abriendo Puertas takes place. As stated earlier, we have the good fortune of working with some great national partners, such as the National Head Start Association, Catholic Charities, United Way, different health clinics. So it takes place in a variety of settings. And so the study here was in a school district. It happens to be the second largest school district in the country. And we work with about 15 other school districts throughout the country. But primarily we work with community-based organizations and early education centers, and where the findings might look different. But again, the study here is in a school district.
Great. There is another follow-up on that. How long were the sessions? Where did the parents' training take place? And how were we able to encourage attendance and follow-up?
Ruth, do you want to take that, given the experience at LAUSD?
I'd be happy to. So in our school district, well, the program in general is 10 sessions, and sessions are typically 2 hours each, and that's a commitment that the parents are asked to make when they are recruited. In our case, we held the classes at elementary schools because parents who have children enrolled in elementary school, we have found, also have children from 0 to 5 years of age.
Well, I'd like to add something, Alicia. One of the things that we share with parents is that they honor us with 2 hours of their time. We guarantee them that they'll leave with resources and information that they can use each and every day. And we aim high to make sure that the experience is a very engaging and fun experience, and we've got a lot of word of mouth with parents, bringing other parents, bringing their neighbors and other relatives, because we want to make the learning experience fun. And one of the key ingredients for that is to make sure that we have a very warm and welcoming environment when parents walk in. So hence the comments about the music and the decorations and the beaches and all.
Okay, we've got a lot of questions coming in, so I'm going to just address the next one. I believe this one would be to the researchers. Can you address the self-selection aspect of study participants, specifically how they compare to the population at large, families of low income with children ages birth to age 5 served by LAUSD, and how Abriendo Puertas can reach families who did not participate? And I guess that last question would be more for Sandra.
Yes, it sounds like a shared answer. I mean,
yes.
The fact that it's a random assignment study, of course, addresses self-selection for the people who are studied. Because we wanted a very large sample for this study, we got a lot of help from the Los Angeles School District, for which we are very grateful, to recruit people. So I think it wasn't just, like a single announcement and the most motivated people would come forward and sign up. There was a lot of effort to recruit a wide variety of people. Clearly, it is a disadvantaged immigrant sample by and large. We have no reason to believe also that it is just the most motivating. It seems to be a very broad club. But I think Ruth can probably comment on that in addition.
Yes, we used some typical methods of outreach as well as more personal ones. So we did the typical things everybody does, which is flyers going to all of the families in the targeted elementary schools to target families 0 to 5. We have the ability to do automatic phone messages to the entire community. We reached out to Head Start programs in the neighborhood of the elementary schools that were in the study. The staff of the schools, as well as our staff from our office, talked to parents as they dropped off their children, distributed flyers and talked to them. And so these I guess this multiple-pronged outreach approach really was able to yield a very large number of interested parents to be placed in treatment or control.
Yeah. Another question here was, how old were the children in this particular evaluation?
The children in this evaluation, like over 80% of them were 3 to 5 years of age. We were looking for children who were next in their family to start formal education, kindergarten, for example. A handful of children were a little bit older than that, may have started late, and a handful of children were younger than that.
Mm-hmm. Also for the researchers here, can you speak more specifically about the measurement tools used? Was it all self-report? I think you already addressed that. But.
We designed questionnaires that were carefully piloted. We did a preliminary study in which we tested everything, including the measures, and we did what are called cognitive interviews, think-aloud interviews with people who were like the respondents to test out the measures. And we also worked pretty closely with our colleagues in California to make sure that the constructs and the questions themselves matched what they were trying to do. Certainly wouldn't want to assess a program on items that have nothing to do with their own goals. So we worked very hard to get the questionnaire right and to test it. The first data were collected in person by staff at LAUSD, and people got help if they needed it filling out the baseline questionnaire. The follow-up questionnaires were done by telephone, and as I mentioned, achieved a very high telephone response rate. Researchers are struggling these days to get people to answer their phones and do surveys. This study was exceptional in the very high response rate. And then, as mentioned, there was a second telephone follow-up for those in the treatment group, so we could find out how they were doing a couple months later.
There's a couple of questions I want to turn to now for Ruth. There are many parenting programs that, what made the what triggered the decision that the LAUSD made to actually use the Abriendo Puertas program instead of others?
The fact that the program serves families with children prenatal to 5 years of age was the initial appeal, because we have lots of parenting programs for the K through 12 student population and their families, but we were really lacking in this, preschool age. And we really identified it right away as a prevention program, that if we could get many, many parents to participate before their children enrolled in kindergarten, that we would see really the benefits for many years to come. Another is that the program was written by and for Latino parents, and as I stated earlier, we have a very large Spanish-speaking population in our school district. And the foundation of the program is based on the concept of popular education. Many of you, I'm sure, have heard of Paulo Freire, and we're all learners and we're all teachers. So it is a program where we don't talk about training. It's really facilitating. Our staff are facilitators of learning and development of parents and themselves. And, we use teatro popular or popular theater, anecdotes or dichos. And so culturally, the program really is very appealing to our parents, our Spanish-speaking parents. And I have to say that it's our most popular, most requested parent education program that we have at this time.
Great, thank you. Thank you, Ruth. Another question along those same lines is if you could talk a little bit more about the train-the-trainer model and how does that actually work?
The train-the-trainer model is conducted through a 3-day Abriendo Puertas Opening Doors Training Institute, where folks are prepared to deliver the program with parents, but as also, in addition to that, they are certified to take the program and train others in their local community partners and such in the program, so that there's an exponential effect and the program is broadly disseminated and there's greater access to the program by the local community and partners. So after a 3-day institute, you're certified to do that. And again, we work in partnerships with several groups. For information about upcoming training opportunities, you could check our website.
Great, okay. So this is a little bit of a different kind of question we received here. As important it is to be sensitive to one cultural background, how would the program adapt to multicultural communities? Sandra?
This is Sandra, yes, thank you. That's a great question. Very seldom is there the situation that we have in LAUSD with such a large, dominant Latino and also highly Spanish-speaking population. Our program is in, as you said, several states, more than 30 states throughout the country, more than 250 cities throughout the country. And in most places, it's conducted with multicultural families, with families, a diverse setting, a group of families, through, as I said, primarily through Head Starts and other places. So the details are translated. The program is in English and in Spanish. And the learning objectives are based on basic practices that are good for any family, regardless of income or language. So that's what we find, that there's a lot of adaptation in terms of some of the, using it in English, and it still resonates well with families, given the engaging nature of it, that it's not lecture, as Ruth said, but it's based on sharing and learning through honoring life experiences. So I think one of the key features to making it work is creating that sort of safe and welcoming environment for all. And that's part of what you learn in the 3-day training institute.
Well, along those lines too, Sandra, and I think this is also perhaps a question for the group, but that maybe you could take the lead on, is, someone's wondering whether these results have been presented to the actual participants and families.
Yes, we've shared this. We're very inspired and encouraged by the findings and the lessons here about how to improve and strengthen the program. And yes, the report is available on our website, but beyond that, we're sharing it in all of our training opportunities. And even more importantly than sharing these findings, we're still getting feedback from parents and partners as to how to improve and strengthen the program. We definitely want to offer the most excellent, the most relatable and relevant resource available. So we're in the process of talking to our lead partners throughout the country, and we've done a survey of parents to ask them what information they'd like us to address. This is a slow process of having this kind of participatory curriculum development. So we're going to test the new material that we've developed with a minimum of 400 parents before we actually produce the curriculum. So we ask everybody to be patient and to call and check in with us as to any ideas or recommendations they may have. And definitely, we share local data with parents, and we also will share the effects of this program, the lessons that we've learned, and actually some of the very significant positive impacts of the program as well. The program was co-created with parents, so that process is still the process that we plan to continue. So in that sense also, we'll be convening parents throughout the country to help us with improvements.
Wonderful. Thank you, Sandra. And for our researchers, can you speak more specifically about the measurement tools used? What was it all self-report?
Yes, it is all self-report. They reported on their satisfaction with the program and their behavior knowledge.
Do you have demographic and other information that allows you to determine whether those parents that participated in the follow-up are similar to those who did not?
Yes, we have looked at that, and we did not find very many differences. They were tiny.
Mm-hmm. How long were the sessions? Where did the parent training take place? I guess this is for Ruth and for Sandra. And how were you able to encourage attendance follow-up? And that's more for the researchers. Mm-hmm.
I think Ruth stated previously there's 10 sessions, 2 hours each, and Ruth, correct me if I'm wrong, I think it took place in a variety of different school settings in low-income communities throughout the district service areas.
That's correct, yes. They were held, the sessions were held at district facilities throughout, you know, we were a large geographic school district, so the classes were held throughout the entire school district in areas serving the target population.
In terms of the response rates for the follow-ups, what we did is we made sure that whoever followed up with the parents spoke Spanish. They called them at their home, and if the parents were ready to talk to the person who was going to do the interview, that's great. If not, they would call back. We also provided a very small incentive for whoever would complete the follow-up. And also, we were very upfront at the beginning, at baseline, that they would be followed up and the reasons why.
Great. Going on to the next question, does the length of time living in the U.S. Make a difference in parents' belief systems? For example, related to diet or related to children's voices to express their true feelings?
I think for this sample, it's a little bit hard to say because the sample in terms of the number of years being here in the United States was pretty similar. And they were mostly Spanish-speaking parents. And so it's really hard for us to answer that question because we didn't have a variety of you know, stay here in the United States.
This is Sandra. So, although the study didn't address that, anecdotally, just in decades of doing this work, I have found that there is a difference, and I think it's one of the, it can be attributed to many things. One of the things it can be attributed to is a greater access to information in English. There's more of a steady drumbeat around health issues and less so around social emotional issues, but there still is more access to information for folks that speak English. So I think I have noticed, again, not part of the study, but in decades of doing this work, that there are variations in terms of people's understanding of the health and social emotional parts of school readiness. and just school readiness in general.
We have another question here regarding the songs. Many parents ask me for songs and such. What is the source for those?
Thank you for that question. We have a lot of music that we play. We use a lot of Jose Luis Orozco's music, who's one of our great partners, but it's a variety of music that we have. And parents, we ask parents to also come in and suggest music and sing songs that they remember growing up. So it varies, but we have a playlist. If somebody's interested, they could contact us and be happy to send it to them.
Another question addresses the curriculum. What type of evidence-informed curriculum was informed, and how did they account for fidelity of the research during the study?
In terms of the fidelity to the program, what we did develop an observation tool to go and observe. I think we observed 2 different sessions at 4 different sites, and with that observation tool is what we tried. We captured the fidelity to the curriculum, and obviously that observation tool was developed in conjunction with reviewing the curriculum.
Great. Okay, so Sandra, this is a question for you. Considering the important gains last for a few months, does Abriendo Puertas have plans to increase the program to more than 10 weeks?
At this point, we do not, because we've tested what parents find is friendly and doable, given their day-to-day realities. I would want you to take a moment to remember the very dire statistic about the poverty levels and the low-income conditions in which a lot of the families work. So we did initially had 12 or 14 sessions, and we narrowed it down to 10. I do want to say, though, that as part of this moving forward and these valuable lessons that were gifted to us through this evaluation, one of the things that's come up from our partners is maybe having less material in the sessions, because there's a lot of materials in there, and also using the same popular education approach and methodology and going from covering the ages of 5 to 8, because parents that have younger kids are very much interested in the next stage of their child's development. So we do have sort of a broad outline to do that work in the near future.
Great. Another question regarding the enrollment. Did almost or most parents complete the 10 sessions, or did any parents disenroll during the study?
Yeah, it's a good question. I mean, we looked at enrollment and the number of sessions that people attended. The LAUSD team kept very careful records, and we found a lot of variability. Indeed, there were parents who missed a session, some who missed many sessions, and a few who didn't actually appear at all. This is an intent-to-treat evaluation, so everyone was included in the analysis, whether they attended 1, 5, or all 10 of the sessions. So it's a very rigorous test of the effectiveness of this intervention.
Did you provide incentives for study participation, and if so, what were these incentives?
We provided $15 for the baseline, for completing the baseline survey, and $15 for the 2 follow-ups each.
And again, along these same lines about the study, were the children in only Head Start, or did you have any that were in private or family home care?
We did not ascertain what kind of care they were in. They might have been cared for at home or in any kind of center care.
Okay. Well, we've got 1 minute left, and I've got a lot of questions still here. So I think I will I will raise maybe as many as time permits, and I just would want to we will take a look at your questions and get back to you, those that we did not, we were not able to address during the webinar. So how did you deal with parents that had one child under 5 but 2 other children, say 6 to 15, were lessons tailored for older children? Sandra, maybe, or Ruth?
This is Ruth. The Abriendo Puertas curriculum, as we've mentioned, is really designed to serve 0 to 5 years of age. And in the schools participating in the study, we were very strict about only having parents or caregivers who had children within that age group. Outside of the study, I had mentioned earlier, we've implemented over 100 schools. Outside of the study, there are parents who may have a 1st or 2nd grader who say, well, I know the class is for 0 to 5, but I think it can benefit. And if we have space, of course, we encourage them to join. But I would say through the primary grades only. Beyond that, really, the program would have to be very, very carefully adapted. So we do try to stay within 0 to 5 as much as possible.
And just to add, and there, in the population that we work with, that the importance of 0 to 5 and the science of brain development is still new information, so there's a real hunger for it, and we think it's an important contribution to the field that this work is done with Spanish-speaking parents, where there's a lot of assumptions about their reading habits and their parenting. So we find that there's a real hunger and a real acceptance of new information when it's presented in a way that honors their life experiences and is something that will clearly benefit their child and is demystified as to what all that means. So we're looking, as I say earlier, to expand to cover different ages because we get a lot of requests for that. And hopefully someday there'll be one program that all parents can use that'll be evidence-based and accessible throughout the country, for all the partners. But till then, it's hit and miss with parents as to what they have access to in their local communities. And we're very motivated to provide an excellent resource. And I just want to thank everybody for giving us the opportunity to have these lessons, and all the people that are on the line. This has been a very collective process from the beginning of the development of this curriculum to where we are now at this sort of a milestone moment. And I think one of the key points and lessons for all of us is that we go back and listen to parents and make sure that we're respecting their life and their positions and what they want for their children. So we're very hopeful about the future, and thank Child Trends for all this great work, so that'll help us move forward on sure footing and allow us to keep reaching for very reality-based and proven ways to support families with their day-to-day decision-making.
This is from Child Trends. We want to really thank all of you for participating. I mean, I've been looking at the numbers here, and people have stayed on the call. So we're 3 minutes over. I know there were some questions we did not answer because we just did not have the time. We will make an attempt to email you the answers to these, and just wanted to encourage you to go online, and you can download the full report as well as the executive summary and discussion brief. On behalf of Child Trends, I want to thank all of you and thank the panelists. And we look forward to our next webinar with you. Thank you.